Welcome. On today's episode, we're going to be doing a quick look at how acupuncture could be used to help with shoulder pain. Kind of looking through all of the literature on this, I've decided to take a little bit of a different tact on it. Usually I kind of go around the prevalence. I talk about, the impact, the economic impact, that kind of stuff. And originally what I had planned was kind of a talk through what frozen shoulder is, and then a separate episode on impingement problems, tears, that kind of stuff. But really where a lot of the work seems to be going now is thinking of shoulder problems and at least how we deal with shoulder problems a bit more less specific and kind of like, although there's definitely a role and a need for specific types of diagnosis and specific treatment plans. When it comes to acupuncture, it probably doesn't matter so much as to the underlying pathology, but more about where the problems lie. And so what we're going to be doing is thinking about some real life, actionable things you can do right now, straight away, using acupuncture, and we're going to use this based on a meridian type approach. So we're going to dive right on in. Let's see what we're going to come up with. So first up, if we think about something where the shoulder pain is kind of located generally all over the shoulder. So there's not like one specific area. It's not mainly anterior or posterior. It's kind of just like spread around the whole shoulder. What options do we have? If we think local to the area, what have we got? We've got large intestine 14 over the deltoid tuberosity. So right over here. We've got large intestine 15, which is the anterior eye of the shoulder. So large intestine 15 sits between the anterior and mid portions of deltoid. So we've got those 2 points, kind of sit right in that area, lovely. To go with large intestine 15, we have another one called triple energizer 14, and that one pairs lovely with the large intestine 15. These are referred to as the eyes of the shoulder, and they're often needled together. So we would do those as well. Again, thinking of those generic shoulder pain patterns, we're going to bring in a couple of other extra points. So we're going to bring in the Zhanaling. There's an anterior and there's a posterior Zhanaling. So Zhanaling, one that is between the anterior eye, i.e. large intestine 15, and the end of the axilla crease anterior aspect. So we're going to be anterior eye, we're going to be axilla crease, and we're going to go midway between the two. So that's where our Zhanaling is. And then we're going to do the same on the posterior aspect. So we're going to be looking at the posterior eye and the posterior axilla crease midway between the two. So in effect, what I've just reported there are 5 needles in and around the area. We've got large intestine 14, which is at the deltoid tuberosity. We've got large intestine 15, which is the anterior eye between the anterior mid portion of the deltoid. We've got the posterior eye, which is between the posterior portion and the mid portion of deltoid, obviously more posterior aspect. Then we have the Zhanaling, and the Zhanaling there's an anterior one, which is between the anterior eye and the anterior axilla crease. We have the posterior one, which is posterior eye and posterior axilla crease. A couple of other notable additions. We've got large intestine 16 as well. So this one kind of sits on the posterior aspect of your acromioclavicular joint. And that's where I'm thinking about, certainly if people are reporting acromioclavicular joint pain, if they're talking about pain or restriction of movement right at that end of range of abduction or flexion, that's where I'm thinking about using the large intestine 16 in there. Now, if they've got something like more kind of like upper trap type shoulder pain, I'm going to bring in gallbladder 21. But I'll be honest, I wouldn't be needling gallbladder 21 as a go-to point for all shoulder pain. I think those 5 or 6 points I've just listed, large intestine 14, 15, 16, triple energizer 14, and the Zhanaling, they would be kind of my go-to ones. Gallbladder 21 would come in if I thought there was more pain that was kind of radiating up into the upper traps region, or if I thought that there was a lot of kind of like upper traps activity going on there, which may hinder the use of the shoulder. Then going a little bit further down, if we're talking about like more of a generic shoulder pain pattern, I'd be looking at a large intestine 11, which is at the elbow. And then it would depend really as to how much pain they're in. But generally speaking, I would tend to then go for a large intestine 4 for a generic shoulder pain. Mainly because it's a really good all-rounder pain point. And I've said on multiple podcasts in the past, this is the most overused and abused acupuncture point. So if it's severe pain, definitely large intestine 4. If it's anterior shoulder pain, definitely large intestine 4. If it's none of those things, I can be persuaded. I could be persuaded to go with large intestine 4. I could be persuaded to go with triple energizer 5, just 2 sort of below your risk crease. I think both of these options could prove to be really helpful. So that would be my kind of go-to, if you like, for my generic shoulder pain. The 5 around the shoulder, large intestine 14 and 15, Jana Ling, triple energizer 14, large intestine 16, just above or just behind the acromioclavicular joint, large intestine 11, and then either large intestine 4 or triple energizer 5. Not really bothered which one it is. If there's more of an anterior problem, go LI4. If it's more of a posterior problem, go TE5. Okay, so next, if it was, let's say it was more of an anterior shoulder problem. Anterior shoulder meridians are the lung, the pericardium, and the large intestine. We don't really use a lot of points on the pericardium, really. We use pericardium 6, that's the big nausea and vomiting point, but other than that, it's not really a meridian I go to that often, if I'm honest. So we're probably looking more predominantly at the large intestine and the lung meridians. So if we're thinking that this is anterior shoulder problems and it's kind of like anterior chest wall shoulder problems, so you maybe think there's, I don't know, say for example like a coracobrachialis involvement in there, or anterior glenohumeral joint, you're going to be thinking about lung 1 and lung 2. Now these are super dangerous, right? So they're okay to be needled, but absolutely don't just go off the hoof and needle these points, right? Make sure you've had demos done for you, and that you've been practicing that with somebody with you, because the anterior chest wall, obviously we could puncture a lung here, and there is a temptation to sometimes people to go too deep, or for the angle not to be right, or to use too big a needle. So lung 1 and 2 can be really good acupuncture points for anterior shoulder pain, but comes with a massive dose of caution in there. Following along the lung meridian, I'm probably also thinking about lung 3. I'm particularly thinking of things like lung 3, lung 4, and lung 5 if there's a biceps involvement. So the lung meridian over the upper part of the arm really goes alongside the lateral aspect of your biceps. And so I think the lungs are really good at meridian if you think it's a biceps issue there. Next, we're going to be combining in some large intestine points. So large intestine 15 and 14 for certain, because they come over that anterior lateral aspect of the shoulder. So those would be definite yeses. We could bring in a large intestine 13 and 12 large intestine 13, we're kind of getting on the edges of the dermatome. I think you're getting a large intestine 12, it's a bit more like you're thinking if it's an elbow problem. Probably large intestine 12, not so much for anterior shoulder pain, but certainly 14 and 15, and maybe large intestine 13 as well. What we've got so far here, if you think like the picture here for anterior shoulder pain, we've got lung 1, 2, 3, and 4, particularly if it's a biceps. We've got large intestine 15, 14, and maybe 13 in there as well. Really good, all anterior part of the shoulder. And then I'm thinking of my distal point. I'm either going to go with a lung 7, which is just proximal to your radial styloid, or I'm going to go with a large intestine 4. Large intestine 4, like I say, gets used for pretty much everything and anything, totally overused and abused, but if it's an anterior shoulder problem, that is the strongest point on a strong meridian there. It's a good one to use, right? And lung 7 would be an option. Lung 7, certainly if you think it's kind of going more along that kind of like very much more anterior aspect than anterior-lateral, then lung 7 might be an option. If you had more of a posterior shoulder problem, then we're looking at the posterior shoulder meridians. So you're looking at things like triple energizer and the small intestine. The nice easy ones on this one are small intestine 9, 10, and 11. So these all sit around the posterior aspect of your scapula, very much in the area that people will be getting pain. And I'd combine that with certainly a triple energizer 14. So then you're going to have 4 acupuncture points local to the posterior aspect of the shoulder. You could throw in a gallbladder 21 in there, although that's more superior. It's kind of like a lateral type meridian, so that might get thrown in there, but definitely small intestine 9, 10, 11, and a triple energizer 14. You could put in a triple energizer 13, which is again just a little bit further on down the upper part of your upper limb. So that would be another little option in there. And I think that can be something that you see fairly often. And then we have a little bit of emerging as well. So because of where large intestine 14 is basically over your deltoid, right? If you think about where your deltoids attach into is the deltoid tuberosity, but their origins, you've got a posterior deltoid, you've got a mid portion of deltoid. So the mid and posterior portions of deltoid will be on the side of where you get posterior shoulder pain. So I think large intestine 14, even though the meridian kind of diverts anteriorly, I think large intestine 14, because of the muscular attachment to the area, is also another good one. I'm also going to give notable mention to large intestine 15. So we're talking about that one for your central shoulder pain and for your anterior shoulder pain, but it's also one that kind of like gives triple energizer 14 a bit of a boost. So triple energizer 14 is the posterior eye of the shoulder, and large intestine 15 is the anterior eye of the shoulder, and the eyes work better together. So it doesn't really matter if it's anterior, posterior, mid, doesn't matter. If you're going to be using the eyes of the shoulder, do them both together. So my kind of points there I've got for your like local in and around the area: small intestine 9, 10, 11. So there's 3. We've got triple energizer 14. That's 4. We've got triple energizer 13, which is 5. Then you've got large intestine 15 and large intestine 14. So there's another 7 points that you've got there. You could throw in a gallbladder 21 if you thought it was more of kind of like an upper traps involvement in there. When it comes to your distal points, you've got 2 options. You've got triple energizer 5 and you've got small intestine 3. Really quick and easy way to think about this. If you think there is some spinal involvement, or they do have some like neck, upper thoracic pain, which you think is completely separate, go with small intestine 3. Small intestine 3 is thought to have a benefit of the spine. There's some Chinese medicine take on this, which is to say that it opens up the governor meridian, or sometimes referred to as the Du meridian, but it opens up the governor meridian, and thought therefore it's coded for some spinal pain. So if the patient just so happens to have some spinal problems as well, or you think there might be some spinal involvement, I'd go small intestine 3. If, however, the pain is like a posterior shoulder pain, but kind of radiating beyond the glenohumeral joint, so it's coming into that kind of the upper arm, maybe as far as the elbow, or that would kind of suggest not really a shoulder problem. But if it's kind of going beyond the glenohumeral joint, it'll be a triple energizer 5 for posterior shoulder pain. Hopefully that's been a really helpful, quick-fire approach to different shoulder issues. We've covered generic shoulder pain, we've covered anterior shoulder pain, and we've covered posterior shoulder pain. So rather than talking about these things as like specific pathologies, like tendinopathies and impingements and we'll kind of talk about where symptoms mainly sit. Oh, I've got one more. Actually, sorry, I totally forgot to mention this. So there is another acupuncture point we can use which can help with shoulder stiffness. It's nowhere near the shoulder. It's on mid-shin, right? So stomach 38. Stomach 38 is midway between your lateral joint line of your knee and your lateral malleolus. So midway between those two, and it's just one sun lateral from your tibia. So it's kind of like mid-shin over tibialis anterior. There's a point there called stomach 38. Now, how are you supposed to needle that one? And I have actually done this to some pretty cool effects, actually. You needle stomach 38 bilaterally. And that's all, you're not putting any shoulder needles in locally, right? So you put your stomach 38s in bilaterally. And then what you do is you do some strong stimulation at stomach 38 whilst getting your patient to do some like active assisted shoulder work. So what I used to do is I used to give somebody like, say, like a walking stick or some kind of something where the... let's say it was a left-handed problem, left shoulder problem. The right hand and the left hand are both holding the stick, and then I'm getting people into like to come into extension of the shoulder. Sorry, coming into flexion of their shoulder. So what's happening is the right arm is helping to kind of lever up and pull the left arm through that range of movement, and I'm doing really strong stimulation at stomach 38. And what you find is that over a period of time, that people's movement gets better and better and better. So within the session, people are saying, you know what, it just feels like I can move loads easier. Then maybe they're using like a reference point on the ceiling. So I tend to lie people prone when I'm doing this. Supine. So I get them lying supine, so they're looking at something at the ceiling and kind of having like a benchmark as to where they could move their arm to. And then after a session of doing really strong stimulation at stomach 38, they're finding that they can get that much further afterwards. It can get really intense though, so I do tend to give people a little bit of a break. I'm doing strong stomach 38 stimulation. They're doing this kind of movement, flexion extension with a walking stick to try and drag that shoulder up. And then when it gets really sore at the stomach 38, I'd give it a pause and maybe come over to the glenohumeral joint and do some manual therapies on it, just to kind of do some more mobilization work to see if we can free that off a little bit more. Then back to stomach 38 to see if we can give it a really big dose to try and get moving. And then once they get to the point where it's like, okay, this is super, super intense now, I don't think I can get any further, I'd then finish off with one of those kind of generic shoulder pain recipes. Because with things like frozen shoulder or shoulder stiffness, it's rarely just like an anterior or posterior problem. So I'm going to go with that kind of generic shoulder pain recipe that I referred to earlier. Glad I remembered that, because it's a really helpful one. It's really helped a lot of people with that. Okay, guys, so anterior, posterior, and generic shoulder pain, as well as some shoulder stiffness recipes with a cheeky little stomach 38 thing there. It's a bit of a different format, right? I'd like to hear what you think of it. It's more to the point in terms of what you can do clinically. I'm hoping that this is stuff that you can use straight away, like as of tomorrow. So let us know your thoughts. Please like, comment, and share. I know I say this at the end of all of our podcasts, but it does really make a massive difference. So get in touch, and I'll see you soon.